Greetings, I'm Dike Rostant. Welcome back to the TTT News. The measure of a person and a country is taken by how they treat the vulnerable persons they interact with. Now, with that in mind, we go in depth on the work of the Ministry of Social Development and Family Services Social Displacement Unit with Executive Director Loraine Reyes-Borel. Welcome, Mrs. Reyes-Borel. Thank you so much for making the time. I want to start off by asking the ministry's responsibility as it relates to the socially displaced population of Trinidad and Tobago, please.
Okay, it's a pleasure to be here, Mr. Rostant. Well, for the ministry, social displacement falls under our ministry, and specifically the Social Displacement Unit. So our unit was established in 1999 with a mandate to implement, coordinate, monitor, and further develop programs and services to address street dwelling. Specifically, the unit's programs and activities include direct provision of social work services, so for example, the assessment, counseling, advice, and referrals to treatment and rehabilitation centers for the client population. Our client population does include deported nationals of Trinidad and Tobago. Included also is the establishment and monitoring of the assessment, treatment, care, and other intervention facilities that provide services to persons living on the streets. Institutional strengthening programs for NGOs are also conducted for those non-governmental organizations that provide service delivery to our clients, public education activities. And when it's specific to the clients, to the persons living on the streets, we assist them with obtaining knowledge and having access to the programs that are available to assist them in accessing these programs. And these programs, basically, it's intended to meet 4 basic areas of need, which is shelter, treatment, rehabilitation, and eventually employment where possible. So we look at providing these interventions along what we refer to as a continuum. And this continuum essentially has 4 major stages. The initial one being engagement, which is just that, out on the streets, engaging the clients and advising them what is available and how they can access it and helping them access this. So that is the first step. The second step is temporary care. So you give them the knowledge. And then the second step is the provision of shelter, which is an immediate option to sleeping on the streets, where they can then have some level of stabilization in terms of their mental or physical health. They provide the assessment, begin that level of counseling that they may need, and to develop what we refer to as a care plan for each client. Moving on from this second stage is the primary care, which is where the actual treatment or rehabilitation would take place for this particular client. And this could be at hospitals, rehabilitation facilities, or hostel halfway houses. The goal here is to assist the client with addressing what is their problem and with the whole idea of their becoming self-sufficient. The last level really is advanced care, because as you can imagine, there will be persons who may not be able to eventually live independently. And this is what we refer to as advanced care. And that would be, for example, in some cases, a home for older persons. And in a lot of cases, it's really just that for those persons who rehabilitation and completely addressing what your challenge is not an option. We need to look at care.
Well, Mrs. Reyes-Borel, I want to ask though, what is the process that goes into describing someone as socially displaced, or saying, okay, well, this person can be a potential client of ours?
Well, it's the engagement is the person being on the streets. We do have persons who come into us and indicate, well, they're having some kind of challenge or difficulty and they do not have anywhere to live, so that they come into the unit and they indicate that they have a problem, they need help. So we do the assessment there in the office to see what help this person can, and we start the process with them. Otherwise, it is the person who is found on the streets that is, and their voluntary engagement, finding out from that person what is happening with your life? Do you need help? Do you want help?
And I really appreciate the word voluntary used. So, where do rights come in saying, okay, well, you can engage this person one way or the other, and that voluntary? What's the importance of that word as you use it, voluntary?
Well, the importance is that we're a social service. So we offer the assistance that the person that we think they may need. We offer what is in our range, what we can provide. And they have the option to say, yes, they want to access our service, or no, they do not wish to access our service. We can't, we don't have powers of to involuntarily engage this person from and say, well, look, listen, you have to access this social service at this point in time. So it's an offer of services of the ministry, which is essentially what the ministry does. The ministry offers its programs to clients, and whether it is a person living on the streets or another aspect of our clients' population, the same applies.
Thank you so much. But no man is an island, but who are some of those stakeholders? What kind of collaborative approach is taken and stakeholders involved for the unit and the ministry to do this sort of work?
Well, our major stakeholders is really Ministry of Health, the particularly mental health service providers, and the police, whether it would be municipal or state police. Because in the end, while our responsibility and our role is to offer the service, there are other the persons on the streets, as some of us and many of us think they all are, but that's not necessarily so. But there are a significant number of persons who have mental health issues, and you want to be able to offer them mental health services so that they're in a frame of mind that you can that they can make better decisions than living on the streets. So a major stakeholder would be our Ministry of Health, and also in terms of the police, as far as the police role again is maintaining the law and order on the street. So the police has a role as far as the engagement of persons on the streets.
And we continue this conversation with you, Ms. Reyes-Borel, Loraine Reyes-Borel, Director of Social Displacement Unit. When we return from this break, stay with us. We return with more. Welcome back. We are looking at the work of the Social Displacement Unit with Director Loraine Reyes-Borel. And Mrs. Reyes-Borel, how did the Ministry of Social Development and Family Services, via the unit, look or deal with the issue of displaced individuals during the pandemic? And this is at a time where we're looking at how we can keep a little distance between each other. So what was that like?
Okay, well, in the end, the early on, the whole because there were so many places that necessarily were closed and not operating, we recognized that our clients and industries would have even greater difficulty in accessing some of their basic needs. Shelter, there's the options for food and that kind of stuff. So one of the programs of the ministry was to increase its subventions to some of our NGOs, so to ensure that meals were available. In addition, the ministry specifically, we did establish a shelter under what is currently the Center for Socially Displaced Persons, and that facility essentially offered the persons on the streets the opportunity which was short-term care and shelter, that they had a place where they would have gotten 3 meals for the day and a place to sleep. They did have opportunity to have access to the social workers in the unit and field officers to assist. So that essentially was a lot of what was done early on. Now we do have a program. Our officers still engage persons on the streets. Of course, we pay attention to social distancing. We do have masks that we provide so the field officers, they have masks that they can offer to the clients when they're speaking with them on the street. So that is maintained. Admission to facilities, there is the need for testing and to where as far as possible to identify what kind of quarantine that needs to be done. So protocols are being observed. It is a little more of a challenge, I think, to really engage the client as quickly as you may want to because of the whole issue of testing, because they don't necessarily want to test. So the engagement is taking a little longer again, because then you have to convince them to test. But it has not stopped the work continues.
And thank you so much for that. And in terms of that work that is continuing, I'm hearing that there are initiatives that are being worked on. And what are some of those current as well as future initiatives? Because I heard P.S. Johnson, she was representing the work that is being done. And I don't know if it's a joint select committee that was happening, but please share some of that with us. Thank you.
Okay. Well, one of the major areas that we're looking at currently is really establishing some additional facilities with specific focus on transitional living. And this is temporary living accommodation that really provides that opportunity for our clients to move from their treatment and testing accommodation phase into a place where that is closer to their own, to normal kind of living, that then allows them to make that jump from there to their own independent living accommodation, or sometimes reintegration with families. So that's a major part of what we're really working to get a couple of these facilities up and running in the shortest time frame possible. We have been looking very closely at a collaboration with the Trinidad and Tobago Police, the Municipal Police, Ministry of Health, to develop this a sustained framework that will allow coordinated engagement of the persons on the street, so we can have something that affects a more targeted relocation of the person from the streets and into the assessment center, so that we can begin that process with them, because all of us need to be in the same place at the same time for this really to work well, and that sometimes can be a challenge, as you imagine, because we're not always at the same point. So it's really working out how can we do this best. So we also do, from what the unit tries to do is to maintain a sense of how many persons are on the streets. So we count persons on the streets. We do that count in the night, so that it gives us a sense of what is the extent of the problem out there, so that when we are planning and we're looking at what we are doing and what programs might be needed, the extent of what we're seeing out there. We do provide subventions for the two facilities that provide the initial shelter for persons, and that is in Port of Spain and San Fernando, and which is where we see, when we do our counts and even just walking in the streets, where we see the major concentrations of our population, which is in San Fernando and Port of Spain. And there are two NGOs that are provided with subvention support for this. For Port of Spain is the St. Vincent de Paul Society, and in San Fernando is Port Shamrock. And again, it's making this intervention for the persons living on the street work has everything to do with strengthening and institutionalizing collaboration among all stakeholders. We want to, and we know that our other stakeholders are also committed to delivering this robust and comprehensive system that will allow us not just, and for a lot of people, it's removal, and then everybody would be happy. But for us at the ministry, we understand and we advocate that it's not just removal, it is removal, yes, it is assessment, it is rehabilitation, it is reintegration, so that it's a process that we all need to work together on. And it's not, again, it's a whole of government approach, so that, and even John Public is invited to be part of this process in terms of understanding. It isn't, it's a continuum that you need to have available, so that the persons on the streets who have a myriad of issues and challenges that we can address, because it's individuals. You need to be able to address this individual needs and that one, to really make a difference with what we see on the streets today.
And with that in mind, Mrs. Reyes-Borel, and working towards a sustained framework that would foster positive rehabilitation and reintegration, has that gone to the level of legislation? What are some of those changes, if any, would need to be made?
Well, we do have a piece of legislation called Act 59 of 2000 that has been subject to, it requires amendment. From the ministry's point of view, there are two things that it's going to allow the amendment that we're proposing, which is to have a process for rehabilitation. We do have two pieces of legislation currently that and particularly Summary Offences Act, it does not allow for a process of rehabilitation of the first person, fines, jail time, which which is not going to work. It's not going to solve our problem. So it is Act 59 of 2000. The amendments that we're proposing has everything to do with providing a system of rehabilitation for the person. So instead of punitive, it will be looking at having this person access a system of rehabilitation that is required through law. And that's a major part of adjusting the legislation. And of course, when we talk about strengthening and the whole collaboration, is also going to look at that, the amendments to create that cohesion among the major stakeholders that will then allow us to have our identified roles and responsibilities. It will also allow for licensing of facilities that provide the care and interventions for persons on the streets. And that's also a necessary component of what is needed to respond.
And you just spoke about those major stakeholders, and I'm an advocate for having policy in place, because sometimes a personality may change and things may get better or things may get worse. But if you have this ironclad policy that we can treat with, it's not as though there's something that, okay, well, I feel like doing it today or I don't feel like doing it today. It's harder to be able to get away with having an attitude like that. But you spoke about major stakeholders. Minor stakeholders or the lay persons, you also said that they can be a part. We can be a part. The numbers that we're seeing, 623-2608, extensions 5701 to 5705. But how do these lay individuals, how do persons on the street, how do the man about town help in terms of contributing to the work of the unit?
Okay. Well, we have a lot of people they do call and say, okay, fine, I have someone who I've seen someone in the streets and I want to help, and they call the unit, and that's great and that's fantastic. We do also have NGOs that are working with and provide some kind of service and assistance to persons. So just to get to know your NGOs, find out which ones are working with the street dwelling population and see where you can help. We have a lot of people who are very, very invested in providing meals, because it's a critical part of our lives. It's difficult to conceive of somebody hungry if you have surplus food. So find the NGOs. Provide the foods, your meals via the NGOs. Support your NGOs program. If you have some particular talent or skill, again, engage the NGOs, because again, as indicated earlier, it's a process of rehabilitation that has to happen, and you may have a skill that will allow that you can offer to an NGO, who then would be able to deliver a particular type of program using your skill. So it's a lot has to do with finding out where and which NGOs and how best you can help by supporting the NGOs. And yes, if you do see someone that you want to get some help for, call the unit and we will respond.
And thank you for helping us. Remember, it's an all-hands-on-deck approach. Loraine Reyes-Borel, Director of the Social Displacement Unit at the Ministry of Social Development and Family Services. And on behalf of the entire TTT News team, I'm Dike. Thank you so much for joining us.